Introduction to the care planning process. Introduction to the module. Care planning is the process by which healthcare professionals and patients discuss, agree and review an action plan to achieve the goals or behavior change of most relevance to the patient. This module will help you to explore the various models and frameworks for care planning. Topics to be covered. What is care planning? What is a care plan? Why are care plans important? Levels of responsibility and a philosophy of care. Models and theories of health and social care. An empowerment model of health and social care planning. Components of a care plan. Care planning and professional standards. Accountability in care planning. What is care planning? If you work in an environment that provides health care, you must be able to address the health and well-being needs of individual people. When practicing in health and social care, you have three primary responsibilities. Firstly, you are accountable to the person for whom you are providing care, and you need to be able to justify your practice based on the best available evidence. Secondly, you are accountable to your managers and team members for delivering a good quality service to the local community. Thirdly, you are becoming more and more legally accountable for your practice to your professional bodies and to the government in the form of national guidelines within which you practice. What is a care plan? A care plan is a comprehensive record, handwritten, pre-printed or electronic, of essential information which is created following discussion with the individual, detailing priorities of care aimed at meeting the needs of the individual. This record consists of a table featuring problem identification, patient goals and nursing intervention, alongside day-to-day living activities affected. This is a legal document that is managed and stored in accordance with legislative and professional guidelines, whilst still being accessible to the individual patient and other healthcare professionals with responsibility for care delivery, whether in the hospital or community setting. Why are care plans important? A care plan is vital to ensure that you continuously provide the proper amount of care throughout time, and that the personal requirements of your patient are known to you and everyone around them. A good care plan will help you understand your patient's health better, help them live as independently as possible, and have more control over their life. A care plan is also important because it enables the family and other loved ones to understand the patient's wishes and how they can assist as well. Levels of responsibility and a philosophy of care. Professional organizations often include a code of ethics that outlines what a person should expect while receiving care from services provided by that organization. It can be used to remove people from the professional register if they are not followed. A philosophy of care should outline the principles of care that a person can expect from a service, and to which that service can be held accountable. Where there is no philosophy, guidance such as a clinical and social governance framework or other evidence-based practice guidelines can be used. Models and theories of health and social care. There need to be some basic definitions in order to clarify meaning. A philosophy is an integrative approach to providing care that is based upon the principles of knowledge and theory. A theory is a scientifically studied concept that, in most instances, has been researched and can be proven. A model is a more basic or scaled-down version of a theory that may or may not be based upon research. A framework is a visible process outline that can be used in everyday practice and may not be linked to a particular theory, but can be used to attach to a theory or theories. Many policies are based on government guidelines and models of health and social care delivery. These models are classified into the following categories. The biomedical model. It focuses on recognizing and treating signs and symptoms of the disease. This model is mostly used by doctors and individuals in the medical sector, particularly when dealing with complex physical needs. The social model. This model focuses on developing the strengths and skills of individuals or groups to overcome disability or impairment. This model is used more widely in social care and where people suffer from a disability or long-term condition. The holistic model. It considers physical, social, psychological, spiritual and environmental needs to help the person to become more empowered over their lives. The biopsychosocial model. This model looks at the three main areas of the lives of the people, biological, psychological, and social, and attempts to incorporate a holistic approach. The empowerment model. This model looks at wider influences on individual health and recognizes that some of these influences may be outside the control of the individual. Encouraging adaptation to a given environment empowers and involves the person in need of care and helps them to develop skills in their own health promotion. An empowerment model of health and social care planning. Empowerment seeks to help a person gain greater control over their health and social needs by taking a more holistic approach to providing support and information. An empowerment model must recognize the physical, psychological, spiritual and social needs of an individual. Empowering practice requires a collaborative approach between the person, the practitioner and the local service providers in order to address the needs of a person and access appropriate resources. Holistic or empowering practice cannot be done to a person, but rather is a theoretical or philosophical approach to working with people to ensure that all their needs are being met wherever possible. Components of a care plan. The care planning process includes at least 5 pieces of documentation. The initial assessment, used to obtain basic information such as contact details of the person, their relatives and their doctor, any known allergies or conditions and medications taken. A holistic or biopsychosocial assessment seeks more in-depth information on the needs of the person. A risk assessment to identify the need and prioritize risk. A care plan that outlines needs, identifies plans or goals to address those needs, implements certain actions to achieve those goals and evaluates the whole process. A record sheet to document activities related to the care plan and to serve as evidence during the evaluation stage. Care planning and professional standards. Care planning and documenting care are essential parts of the nursing profession. You must demonstrate that they have achieved the necessary standard of proficiency related to care planning. Nurses should be able to demonstrate the ability to implement and evaluate care in partnership with patients, their families and carers. Once registered, if you fail to competently carry out any part of the care planning process, then you could be in breach of your professional code. Accountability in care planning. You are ethically accountable to patients, to do them no harm, non-maleficence, and to do your best for them, beneficence. You have a trust-based relationship with your patients. You are professionally accountable to the Nursing and Midwifery Council, NMC, which expects certain levels of professional competence, and for you to accept the rules and regulations of the profession set out in the NMC Code. Finally, you are legally accountable, and you must not break the law while practicing nursing and in your personal life, as you may face legal consequences for your conduct. Registered nurses are answerable for anything that they do, actions, or do not do, omissions, for patients, and as such, they must be able to explain, justify, their decisions. Good care planning and care plans can help nurses to do this by demonstrating that decisions about the care were based on a comprehensive assessment of the patient, systematic nursing diagnosis, planning of care, evidence-based implementation of care, rechecking, and evaluating using a recognized framework. Registered nurses are accountable not only for their own actions, but also for those to whom they delegate work. Summary. In this module, you have learned: if you work in an environment that provides health care, you must be able to address the health and well-being needs of individual people. A care plan is a comprehensive record, handwritten, pre-printed or electronic, of essential information which is created following discussion with the individual, detailing priorities of care aimed at meeting the individual's needs. A philosophy of care should outline the principles of care that a person can expect from a service, and to which that service can be held accountable. An empowerment model must recognize the physical, psychological, spiritual and social needs of an individual. Thank you. This is the end of this module. Thanks for watching. Happy learning.